Okay, let's talk about the hands rejuvenation. That it's so important because many people they don't take care of their hands. So I'm beginning here with you. This is not an industry sponsor presentation. I'm Mariana Correa from Brazil. You know, it's my first time here in this year, and the other year here too. And here you can see here about this Madonna. You can see the difference of her face and her hands. It's possible to see the veins, the bones, and all the wrinkles of her hands. So it's very important because she's very international, very, very famous. And on the pictures, it's possible to see the difference of her face and her hands. So many people, how it's my hands? It's not so good. So I need to treat my hands. A lot of patients of mine, they say, my face is so good, my neck is good, but I need to treat my hands. So it's a great harmony of us. When we lost a lot of fat, muscle, collagen, elastin, it's possible to see the difference of our hands. And here, about an article, these grades from 0 to 4, it's possible to see the difference from Dr. Caruthers, this article from 2008. It's so important about the severe loss of the fatty tissue and the market of the visibility of the veins and tendons, and the sun damage that you can see in the grade 4. That it's very important because many people, they have many sun damage because of the routine. About the science of hands aging, it's possible to see the skin dynamics. There you can see the wrinkles, the signs, and the aging, and the fat depletion. That we can see how the skin texture is very different on our hands, and the collagen decline. That it's very important to do the possibilities of the collagen biostimulator. And here it's possible to see like the baby, how it's possible to see the veins and tendons on the baby. No, only the collagen. And the third hand, it's possible to see the veins, the tendons, the wrinkles, and many difference of the hands. And what to make hand looks more younger, in your opinion? I'll share with you this article from Patricia Ogilvy, that it's not here now, but she's very special for us here in this Congress, about the importance of the hands rejuvenation. And the most technique that she uses is the radius, that is a safe injectable filler suitable for hands rejuvenation, and it's superior to other treatments. So the skin texture will be much better than only the fillers. And here it's an article from 2023 that it's the possibility of the surgery in the hands, that is the fat tissue, and the biostimulator, that it's very different. The biostimulator will have a rejuvenation of the skin, and the fat will be only the volume. So it's a big difference of the patients too. And now a beautiful and so important article that is a new one from my dear friend Shino Bay, that is my mentor from many years ago, since 2016. And he used the regenerative treatment for calcium hydroxyapatite with micronutrients that it's very good for the skin quality, for rejuvenation, for the luminosity of the skin. And in this article, he explained about the face. And I'll share with you too the before and after the baseline of this article of him from week 3 to week 6, that it's possible to see the difference of the tissue. And the technique that I'll share with you, the video, is the protocol of hands rejuvenation of radius with NCTF. Because NCTF, they have a lot of benefits that will stimulate more collagen together with the radius. Here it's possible to see again the immediate post-application of my patient and the before. So it's possible to see the immediate result. The technique that I use in each hand, one syringe of radius, with 1 cc of NCTF that I mix to, and the cannula I use TSK 22 gauge, 70 ml, at proximal dorsum of the hand that it's more safe, and the cannula in the subdermal space. Here it's a great article from Anatomy that explains that it's more safe doing the procedures of the hands, doing the cannula versus needle, and the proximal to distal fanning technique, and the subdermal space too, that it's more safe. So this is an important scientific study about the anatomy of our hands. The technique that I use is this that I explained for you in the first presentation today. That is the NCTF that have hyaluronic acid pure, and another benefits like vitamins, minerals that stimulate collagen, and another benefits. So I use in the lower eyelids, the face, together with collagen biostimulator, that will have a great result. And here I'll share with you the technique that I use, the mix. You can do a video.
In this protocol, I mix 1.5 cc of radius with 1.5 cc of NCTF, then mix it 20 times to be well diluted to inject in the hands. Now it's ready to apply in the hands. And then I use the cannula TSK 22 gauge, 70 ml. I sterilize hand and I inject lidocaine for the pain. And then I make 2 entry points with a needle for the cannula. I begin the procedure from the proximal to the distal. Here, in fanning the product through the hand in the subdermal space, because it's a safer area. The patient feels no pain and there is no bruising. It's very safe. Then I make a massage to spread the product and to avoid nodules. I recommend the patient to make a massage at home every day during 2 weeks. Now you can see the difference. This hand with no treatment, with the, it's possible to see the veins and tendons, and the treated hands much more beautiful and rejuvenated.
And for a coincidence, this patient is from Brazil, but she lived here in Stockholm, and she went to Brasilia, and she told me, oh, no pain, I feel no pain, it was very good, and no bruising, nothing. She liked it so much, the result. And this is my mother, 66 years old, and she told me, oh, my face is so good, but my hands, it's not good. So please, Mariana, treat my hands. And okay, I treated her hands. And here, the immediately post result that she liked it, but the best result, it was 30 days after. So you can see the skin quality, the luminosity, how the skin, it's much more, is a big texture. The texture is, it's much more beautiful than the pre-treatment. And another patient of mine, that is the immediately, that one from the video, and the pre-treatment. This other one from 56 years old, 30 days after. And this is another patient that she liked so much the result, 30 days after, age 50. And it's so important for a good result and durability to explain the patient that it's not only injectables. You need to hydrate your skin, you need to take care of the sun, so it's important. So sometimes I explain to the patient, use retinol during the night, or sometimes the patient use peeling. I have in my clinic photona, so they use some kinds of laser. So it's important to another skin quality of her hands. Exosome I like so much for hands, regenerative skin rejuvenation too. And sunscreen is so important to use every day. And the prevention, look this patient of mine, she told me, Dr. Mari, look my abdominal skin, and now look my sun damage of my hands. So it's very different, the aging of her abdominal and her hands. So you can see the wrinkles on her hands, the sun damage. So it's very different. And many patients, oh, it's totally different, the skin quality of my face, my hand, my neck, or my abdominal. So the prevention is totally different and so important. Love and take care of yourself every day and from your patients, family, friends every day. Thank you so much for the attention.